that we will be given. So PT and INR, which this formula shows that the INR is known to be the international normalized ratio, and the ISI also as stated international sensitivity index. So why we need to check PT? Because PT in an oral anticoagulation therapy patient will vary with the type of thromboplastin reagents such as rabbit, human, or bovine, etc., used in the assay. So this difference in sensitivity is known as the sensitivity index. As individuals, thromboplastin can be calibrated against the international WHO reference thromboplastin, which is the International Reference Preparation, or the IRP shortened, to assign them to an International Sensitivity Index, or ISI. So PTINR is very important in this to monitor patients who are taking warfarin and anticoagulation medicine, especially because the INR increases, which means the blood will take more time to coagulate. So thromboembolic is events on the left, and hemorrhagic is on the right. So as a balance, as INR increase, the clotting decreases. So but this will make a more risk of bleeding, so that if no clotting happens, patient will bleed. So it is very dangerous for patient, especially for patient who takes warfarin medication. So the therapeutic window for patient who are taking warfarin medication is 2.0 to 3.0, which is their therapeutic window, and patient would need to have this range in order for them to not bleed excessively or the blood to clot faster. So INR is important for monitoring unusual bleeding, as according to the Handbook in Clinical Use of Blood, 3rd edition 2020, where you can see here is that doctor needs to assess INR to give therapy for patients who are on warfarin, and reversal on warfarin therapy depend on the level of INR. So if major bleeding, as example here, major bleeding, patient will be needed to give IV vitamin K for 5 micromilligram, and then PCC as follows. If INR is less than 5.0, doctor will give 15 IU per kg, but if INR is more than 5.0, they give more. So this is INR is very important for doctor to assess what they need to give to the patient next. So let us go into the principle of the iLine micro INR system. So the principle of the iLine micro INR system is using the microfluidic capillary suction. So the micro INR system comprises a measuring device and a disposable chip. So you can see here, this is the chip of the micro INR system. And then when the chip will then flow through the capillary action and will suck into the capillary. So after the blood sample application, the coagulate cascade is activated by a micro dispensed amount of recombinant thromboplastin reagent, and INR determination is performed through capillary blood flow monitoring along microfluidic channel. So when the blood goes inside there has the reagent of the thromboplastin. So blood will then mix with thromboplastin, and then will give out a result of the INR, PT-INR. So when clotting, blood undergoes a change on behavior and thus a sudden flow rate decay, which is detected by an embedded machine vision system. So when the blood then mixed with the thromboplastin, will start a clotting effect. So the blood will then start to clot, and then the machine vision system will then detect the clotting time, especially the turbidity of the the system, the mixture, and then will then detect the INR, PT INR. So the measured thrombin time is then converted to INR using a lot specific calibration parameter micro-printed on the chip surface. So later we'll show you the chip because the chip is embedded with a INR lot specific calibration. So how to use the micro INR system is that first you place a lancet firmly against the fingertip to activate and massage the finger to bring blood to the fingertip, and then gently press to help a drop of blood, and then but need to perform the finger stick when the meter starts the 80-second countdown. So the meter has an 80-second countdown, so user no need to rush to apply blood on the chip. So the chip needs to make sure a properly sized drop, which equivalents to a teardrop, and do not press the finger stick side or let the drop spread on the finger. And then yeah, and then the meter will then emit a beep after the blood sample is enough, and a drop symbol will start flashing and countdown disappear. So it means that the system will start calculate the PT time and then also give the INR. So after the beep tone, gently remove the finger and try to leave a small amount of blood on the chip entry channel like this. So a little bit of blood at the chip entry channel. So yeah, this is the chip of the micro INR. So we have two channel, which is first the control channel, which contains human recombinant thromboplastin and human coagulation factors to stabilize patient blood. And then the measuring channel where it contains reagents, recombinant human thromboplastin, where blood goes into this measuring channel, it will then detect the PT time. So this is the control panel to check whether the overall blood and chip is okay to use. So microcapillary channel, where these two channel where blood will mix with the reagent will then flow through, and then is a site where INR is determinant. So these are microreactors.
Iman dia ada tapi tak ada kat juga. Ada.
Okay, so these two microreactors are where reagents for the control channel or the measuring channel will be there, so that when blood flows in, it will then go to two sites and then will flow through two microreactors and combine with the reagent. So this is the data matrix, which contains ISI, International Sensitivity Index, and the normal PT. So this normal PT is to calculate the ISI value, the INR value. So entry channel is where blood enters and separate into two channels here. So this is where you put the blood into the chip. So this is an example of how the chip goes analysis. Is first that when the blood arrives through the entry channel, filling both reaction channel here just now, I said that the two chambers here, and then the blood will then flow through the control channel, which is to check how fast or how long the blood clot. So the MVS, which will then observe different velocity and position of blood flow through separate channels. So the MVS system will then look into these two channels to determine the PT time of the patient. So why iLine Micro INR Expert is first that it has the ability to detect the clotting time, and deviation from non-clotting behavior is enhanced and improved robustness. And the properties of the sample is checked on viscosity, do not affect the endpoint calculation as it is removed from the measured function upon first deviation calculation. So this is the iLine Micro INR Expert meter. And then the principle of the iLine Micro INR Expert meter is using the microfluidic with the MVS system. So sample volume needed is 3 microliter whole blood, and INR range can detect up as low as 0.8 to 8.0. PT time is 9.6 to 96 seconds. So data storage is 2,000 patient results and 500 plasma control, which is the internal QC of this iLine micro-INR system along with their date and time. So battery is a rechargeable lithium-ion battery, and and size and weight is the size is a bit long, and the weight is 307 grams only. And operating temperature is at room temperature, 15 degrees Celsius to 35 degrees Celsius. And maximum relative humidity is 80%. So the meter storage is also at room temperature, normal room temperature is okay. And storage of the chip is at room temperature also. And QC, we have two levels of QC, and the storage is at cold storage is at 2 to 8 degrees Celsius. So we only need two things for the iLine micro-INR system expert. So first is the micro-INR chip, which is to use to measure the PT-INR with the micro-iLine expert. And the expiry is 18 months upon manufacturing and can be stored at room temperature. And the onboard stability of the chip is 6 hours upon open the pouch. So the pouch, one box, we have 25 microchips in one box, and it's individually packed in one packet. So when you open one packet with one chip inside, the open stability is 6 hours. And if you don't open the packet, the individually packed packet, it is 18 months expiry. So yeah, as I said, one box has 25 chip in a box. So we also have the Micro INR Easy Control, which consists of two level, but one level per box. So this is one level, and then another box is for one level. So this is to use to monitor the precision of the analyzer, and the expiry of the Easy Control, which is the internal QC, is 12 months, but stored at cold storage, 2 to 8 degrees Celsius. And onboard stability is short, but when you open, it is only stable for 14 minutes upon reconstitution. So packaging, we have two, as said, level 1 and level 2. With one box, we have 5 set. So the iLine Micro INR system has an onboard 3-level quality control, which automatically check when the system is turned on. And first level is to pre-test where QC when the chip is inserted into the machine. And this is to check the chip integrity, correct insertion, and automatic data reading to check if the data matrix is correct or not. And then second level is the measuring channel where QC is ongoing during the test. So it's to check if there is proper system handling, identify any abnormalities on the PT reaction or ensemble quality. So last level is the control channel, which parallel control channel and the reagent integrity check to check whether the reagent is usable or not. So the iLine Micro INR system has a built-in barcode reader and also an on-screen keyboard here, and then you can type patient ID on the screen. So it is very easy to view, has an easy view interface of PT INR results. So this is the interface of the meter. So you can see INR result is bigger here and PT result is smaller here. So you can see both PT and INR result both here. So when there's also an onboard troubleshooting guide where you click this information, and then it will show you what to do next or show you what this error means. So yeah. So it is more lightweighted and rechargeable battery on board and has a built-in touchscreen display here. So the touchscreen display is big, so it's easier for user to see also. So the chip is also encoded with a data matrix, contain the ISI and PT for the calculation of the INR, and it requires small amount of blood, which is friendly for elderly, especially because it's only needed 3 microliter. So let us watch one video. This video is how to reconstitute the control, which is very easy to use. So this is wait, sorry. So sample preparation, you have two things needed: lympholyzed plasma vial, and the other is the calcium channel vial. And then you need to flick. There's two vial here. And then you just squeeze everything inside into the glass vial and then close the tube. That's easy and neat. And then swirl the plasma and then let rest for 4 minutes until the solution is ready. So the sample application is same as how you the blood application on the chip. So when the chip is inserted, it will then go until a preheat, and then it will give a 80-second countdown. Then you can start doing the QC. So there's a capillary dropper given for QC. So you just use the capillary dropper to take the sample and then do the QC on the chip. So when the meter beeps, it hold the drop for 2 seconds and we move upwards gently. So this is a close-up view on how to do the QC. So just gently approach the tip and then form a drop and contact into the entry channel of the chip. After the beep, you can just gently remove upwards. Okay, yeah. So there is two modes of iLine micro INR expert can be used. First is that you bring the sample to the meter, to the chip, or you take the meter and bring the meter to the sample. So the interference, the meter has no significant effect when the hematocrit is 25 to 55%, and there's no significant effect when the bilirubin is 55 milligram per milliliter, and no significant effect at triglyceride at 3,265 milligram per deciliter, and no significant effect when there's hemolysis presence 600 micro milligram per deciliter, and there's no effect on unheparized heparin or low molecular weight heparin concentration up to 0.2 to 0.4. So the system performance of the iLine micro INR system has been tested with SCL top and also coagul check. So this number of sample with SCL top comparison correlation study, we have obtained iLine micro INR system have obtained an R value of 0.973, which is very high, and correlation study with coagul check XS Roche PRCT machine with 313 samples, correlation coefficient is 0.977, which is very high. So we have also done method verification at Hospital Tunku Jaafar at Seremban, which we have 43 samples with the QLabs micro electrometer. The correlation study is 0.9573, and also did a correlation study with Warfarin SL Top 2 with 43 samples, and correlation coefficient is 0.9683. So we also did another method verification performed at Hospital Sultan Haji Ahmad Shah at Pahang. We have 55 samples with the QLab meter is 0.9205, and also correlation study with Stago in compact 43 samples, correlation coefficient is 0.9209. So we also have a micro INR system, also have an EQA program, which we give EQA program is the lab quality, which an EQA program from Finland. So the EQA program is 1 year twice. It is at May and November. So currently, iLine micro INR has 108 peers with lab quality EQA system, and the CV also shows very good results. So other EQA program also we have is CSCQ at Europe. and also AMQC, and also Nautilus EQA program. So all three EQA program also shows a very good results, especially this Nautilus EQA program also shows a very good results in a 6-year period. So compare with other competitor devices that we have is that I compare with Roche Coagucheck XS, which the principle is different from both meters, and sample volume iLine Micro INR uses 3 microliter, while sample volume for Roche Coagucheck needed 10 microliter, which is larger. So yeah, the iLine Micro INR system has a touchscreen and a barcode scanner, and the battery is rechargeable. So the packaging is individually packed, especially too, so it reduces the risk of contamination. So compared to Expressia Prime Strike, the principle also different. The principle of extremist Expressia Prime Strike is electrochemical, and the principle of iLine is microfluidic and MVS. And sample volume is lesser than Siemens Expressia, which is 3 microliter, while Siemens Expressia is 6 microliter. And so result display, Siemens Expression only display INR, while iLine display INR and PT results. So packaging, especially iLine is individually packed at 25 with 25 chips in one box, and individually packed is helped to avoid contamination between the chips. So lastly is the micro point QLED's PT INR. The principle is also different, which is micropoint uses electrochemical and iLine uses microfluidic and MVS. So also iLine uses less volume, which is 3 microliter, which is friendly to elderly. And yes, and both packaging is individually packed too. So our current installation base for the iLine Micro INR Expert is at Hospital Melaka, Hospital Jasin, Hospital Tuanku Jaafar, and also recently we also have PKD Pekan also using our iLine Micro INR Expert. So thank you, and that's all from me.
Thank you, Miss Esther. So now we proceed with the question. So first question is, what is the most common procedural errors that can
Sorry, can you repeat your question just now?
what is the common procedural
Mm.
error that can affect the accuracy of the INR result?
Okay,
I
so
mean the common.
the common procedure that will affect the INR result is that the first most common is I see is that the blood application is not properly taken, because because actually the iLine is very easy to use, but sometimes because less volume is needed, so people will think that more blood is needed, so the chip is always near the skin. So it's better to have a tear drop for the tear drop of blood to obtain, and then iLine microRNA system will then take the blood effectively. And is there any example that because is there any people is using like PTINR POCT, maybe some other concerns or anything can let us know, and maybe I can see if iLine can has this problem, same problem or not.
All right. So we proceed with the next question. So do you see this technology becoming routine in hospitals within the next 5 years? It seems like already four sites already use the
Yes.
technology. So do you think possible that this technology will be becoming routines in hospitals? What's your
Okay,
comment?
so yes, as in market, we did a survey. PT-INR is quite important, especially in warfarin clinic, especially patient who is taking warfarin medicine. They need to check regularly to maintain their blood coagulation. So sometimes if there's more patient taking warfarin, anticoagulation medication, sometimes doctor cannot every patient needs to go hospital. Is a lot of patient going hospital. So especially PKD pekan, doctors ask patient to go to small clinics so to reduce the workload of hospital. So they PKD pekan also help patient to do the PT-INR. So next time they can just straight away do PT-INR and without waiting for results for the coagulation analyzers such as TAGO and SEL top. So it's faster.
All right, thank you, Ms. Esther. We proceed with the next questions. So, how does your device improve patients' care compared with traditional laboratory testing, other than it's, of course, fast and I don't know. What do you think? What is your opinion?
Okay, so because POCT you can use it anywhere. So especially because patient needs to wait for the lab to do the one of thing is to lab need to wait the lab to give out results, which is a longer waiting time. And second is that POCT you can bring it anywhere and it's very small, so you can bring it anywhere, anytime, and you do the test anytime. And second of all is that because if you use tube testing, coagulation tube testing, you need to take a lot of blood for testing for your INR, PT-INR. But with POCT, especially iLine, uses 3 microliter enough for a fingertip. So it's very fast and low volume. You don't need to take a lot of blood to test for your PT-INR. Yeah.
So the last question, this is the one
Mm.
with me, but we still can uh, receive any question from the floor. But the last question that has been sent to me is, how does the device ensure quality control during each test?
Sorry, can you repeat again?
How does the device ensure the quality control during each test? I think I saw in your slide just now. Can you move to the slide?
Sure, wait.
I think the test that has been tested in in hospital to Pujafar, I think.
Okay. Oh, here.
Maybe you can, yeah, this one, method verification. It says like you have paper for this. So do you have
Okay.
link or DOI for this paper, for this
Uh,
performance?
So this is MV
I mean the
method
report for this.
verification, yes, for hospital to approve if they need to continue on with the iLine. So before they continue on with iLine, we need to do a method verification to check whether the iLine is performed well with their warfarin LCL top, which is in the lab. So if it's okay, then they will proceed with it. This is the report lah. So this report is internally, but we will if other users ask us, we can also give them, but it's internally lah. So did I answer your question? Sorry.
But not publish this. Okay.
Yeah.
It's okay. More user will they will trust more if there any
Yes.
paper on this. But it's okay.
Mm.
System performance. I think this method verification that has been done at space reference to other users. So any other question from the floors? Let me see from the YouTube. Okay, rasanya dah tak ada. Kita tengok juga dekat chatbox. Okay. Okay, nama penceramah tiada dalam feedback form. Okay, tak apa. Okay. Questions for this. So, ada siapa nak tanya soalan lagi kepada Puan Esther? Okay, nampaknya Puan Esther dah Okay, I'm back. Oh my God, suddenly line tak. Okay, okay. Oh my God, start recording again. Sorry for the inconvenient causes. So, yeah, hari ini ada attendant. Nanti kita akan sebarkan. Dan terima kasih sekali lagi kepada Puan Ester Chong. Dan diharapkan perkongsian pada hari ini boleh dimanfaatkan. Dan saya rasa dengan adanya teknologi-teknologi ini, kerja-kerja JTMP akan lebih mudah dan lebih laju dan kita boleh dapat memenuhi lah permintaan apa tu user lah ataupun permintaan doktor untuk kita punya result di hospital. So, saya serahkan kembali kepada Encik Razafwan. Sementara tu nanti kita punya CK akan masukkan di chat box untuk kehadiran. Alright, kepada Encik Razafwan.
Ya, Alhamdulillah. Dengan ini maka berakhir sudah sesi webinar kita pada petang ini. Kami dari pihak KKJTMP ingin merakamkan setinggi-tinggi penghargaan kepada Puan Ester Chong atas perkongsian yang sangat bermanfaat. Dan juga saya ingin mengucapkan kepada terima kasih kepada Yong kerana sudi menjadi moderator pada petang ini. Untuk makluman semua, kita akan mengadakan webinar pada 29 hari bulan 7. Dan kita akan berjemput penceramah daripada BSKB dan Taklimat yang akan disampaikan adalah berkaitan dengan Akta Profesyen Kesihatan Bersekutu 2016 iaitu Akta 774. InsyaAllah taklimat akan bermula pada jam 2.15 petang lah. Dan juga kita akan mengadakan webinar untuk bulan Ogos yang akan diadakan pada 3 hari bulan 8 iaitu pada hari Isnin, yang akan disampaikan oleh Dr. Ahmad Zufairi bin Zulkifli daripada AMD Solution Ceria Berhad. Dengan ini saya ingin mengucapkan berbanyak-banyak terima kasih kepada semua yang sudi hadir pada petang ini. Semoga kita berjumpa lagi dalam siri webinar yang akan datang. Yang ada apa-apa nak cakap?
Ni kita ambil gambar dululah sebelum kita berpisah. Siapa yang ada kamera boleh buka. Yang lain tak nak buka kamera. Cik Muhammad Taufik. Who else got camera boleh buka. Okay. Ni Cik Amri ni kita punya penceramah yang dulu ya. Tak silap lah rasanya. Macam familiar. Okay. Alright. Okay. 1, 2, 3. Unknown border. Okay. More people. The more the merrier. Okay. Kita punya moderator pun ada. Let's moderator. Okay. Sekejap. Nak save dulu. Okay. Lagi sekali. Sekejap ya. Alright. Okay. So thank you everyone for joining us today. Thank you. So kita tutup ya untuk webinar Julai 2026. Assalamualaikum semua.
You.
Thank you Miss Esther.
Thank you, Miss Ester.